Hi friends, in this video we'll study the anatomy of the urogenital region. This is Dr. Yusuf. To begin with, in the lower part of the trunk, there is a diamond shaped structure. This is called as the perineum. So this is the diamond shaped structure called as perineum. So it is divided into two parts, the anterior as well as the posterior part. There it is triangular in shape, so the anterior triangle and the posterior triangle. Anterior triangle is also called as the urogenital triangle and the posterior triangle is called as the anal triangle. So if you see in the perineum, they are not in the same plane, but they are almost perpendicular to each other. So this is the urogenital triangle and here is the anal triangle. Okay, so the urogenital region is the anterior half of the perineum. As you saw, the anterior half of the perineum, that is the pelvic outlet. If you see here, the anterior half of the perineum, this is called as the urogenital region. Okay, this is the pelvis, this is the abdomen and this is the pelvis, and this is called as the inlet of the pelvis. This is the inlet and this is called as the outlet. This is the inlet and this is the outlet. So this perineum as well as the part of the perineum, that is the urogenital region, is present in the pelvic outlet. Okay, so it is the anterior half of the perineum, that is the pelvic outlet, and contains the roots of the external genitalia and the opening of the urogenital system. In this picture you can see here there are roots of the, in this region there are roots of the genital system, as well as there are the urethra and other things which are coming out. So it is that part where we can see the external genitalia as well as the opening of the urogenital system. Okay, so what are the boundaries? Boundaries: anteriorly we have the inferior margin of the pubic symphysis. This is the bony pelvic outlet. This is the outlet. On the other side will be inlet. This is the outlet seen from below in the pelvic region. So in the anterior part we have the inferior margin of the pubic symphysis. This is the pubic symphysis. So the inferior margin of the pubic symphysis, as well as a line drawn from there, that is called as the arcuate line. Okay, then laterally we have the ischiopubic rami. So if you see here on the lateral side, this is the ischiopubic rami on either side, and these are the ischial tuberosities. On either side we have the ischial tuberosities, and this is called as the ischiopubic rami on either side. Okay, and posteriorly, if we draw an imaginary line through this ischial tuberosity, joining both the ischial tuberosity, that form the posterior boundary. So anteriorly we have the inferior margin of the pubic symphysis as well as the arcuate line, then the ischiopubic rami on either side, and posteriorly an imaginary line drawn from one ischial tuberosity to the other ischial tuberosity. So this triangle is called as the urogenital triangle, or it is also called as the urogenital region. Posteriorly we have the anal triangle. Okay, so the roof is by the levator ani muscle. We'll see later the roof of this will be formed by the levator ani muscle. Okay, so this is the, once again to appreciate the things, this is the urogenital triangle, this is the anal triangle. Together it is called as the perineum. Okay, so in the urogenital triangle you can see the roots of the urogenital system, as well as the urethra and other things, openings of the urethra and the urogenital system. The urogenital triangle, the arrangement of structures from below upwards will be in the urogenital region, or the urogenital triangle. If you see the structures from below upwards, or superficial to deep, the first will be the skin itself. In the skin, then we have a fatty layer of the superficial fascia. There will be a fatty layer. There are two layers of the superficial fascia in the urogenital region, and in the upper part of the thigh and the lower part of the abdomen. There are two layers of the fatty layer. Superficial fascia, the fatty layer of the superficial fascia, then deep to that there is membranous layer of the superficial fascia, which is also called as the Coleys Fascia, deep inside here. Okay, then we have the contents of the superficial perineal pouch. We'll try to understand that this whole thing region is called as the superficial perineal pouch. Then there is something called as the perineal membrane, a very important membrane here called as the perineal membrane. Deep to that will be the contents of the deep perineal pouch. And then the last one will be the superficial fascia of the urogenital diaphragm. We'll see that. Okay, so the perineal pouches, as we saw, there are two pouches or two spaces. They are called, sometimes they are called as perineal spaces, sometimes they are called as perineal pouches. So both are same. So the superficial perineal pouch and the deep perineal pouch, okay, which are separated by a membrane called as the perineal membrane. What is superficial to that, this whole region will be called as the superficial perineal pouch. What is deep to that will be called as the deep perineal pouch. To begin with, the superficial perineal pouch or space, the boundaries. What are the boundaries? The superficially we have the Coleys fascia. Coleys fascia. Just deep to the skin, there is the fatty layer of the superficial fascia. Then we have the deep layer that is called as the membranous layer of the superficial fascia, which is also called as the Coleys fascia. If you take a section at this level, take a section, this is the side view. If you take a section at this level and see from the front view, this is the front view. Okay, we have the Coleys fascia. The most superficial after the skin will be the superficial fatty layer, then the Coleys fascia. This is the Coleys fascia covering, that is the superficial boundary. Okay, deep we have the perineal membrane. This is the perineum, which is shown in green color. This is the perineal membrane. Okay. Then on each side we have the ischiopubic rami. This is the ischiopubic rami on either side. This bony structure which we saw before, ischiopubic rami. This is the ischiopubic rami on either side. Okay. Then posteriorly it is closed by fusion of the perineal membrane with the Coleys fascia. If you see, trace this, the Coleys fascia will go all the way and it joins with the perineal membrane. Perineal membrane will be here, so it joins with the perineal membrane. So posteriorly it is totally closed. Okay, then anteriorly, but anteriorly it is open and it is continuous with the space of the scrotum. You can see this is the scrotum, this is the testis, epididymis, vas deferens. So this is the space of the scrotum. Then we have the space for the penis, okay, around the penis, as well as the anterior abdominal wall. So anteriorly it is communicating with the scrotum, penis, as well as anterior abdominal wall. This is important, you should remember this, because clinically later we see that if there is any rupture of the urethra, then there will be extravasation of the urine into this scrotum, penis, as well as anterior abdominal wall. Okay, if there is a rupture of this urethra, then there will be urine collected in the scrotum, penis, as well as anterior abdominal wall. That's why it is important. So you should know how it is communicated. Posteriorly it is totally closed. Okay, the Coleys fascia joins with the perineum membrane. It is closed, so there cannot be collection of urine behind, but it will collect into the scrotum, penis, and the anterior abdominal wall. Okay, so these are the boundaries. Okay, superficially we have the Coleys fascia. Deep we have the perineal membrane. Perineal membrane. On each side we have the ischiopubic rami. On either side the bony structures. Posteriorly, as we saw, it is closed because the Coleys fascia joins with the perineal membrane, fused with the perineal membrane. But anteriorly it is open, so there will be communication of this superficial perineal pouch into the scrotum, into the penis, as well as the anterior abdominal wall. So this is about the superficial perineal space or pouch. Okay. So now going to the contents. What are the contents of this space? One is the three muscles on each side. Okay, so there are three pairs of muscle. Okay, the first one is called as the ischio-cavernous. Ischio-cavernous. If you see here, here. Okay, so this is the crus of penis. If you see here, this is the penis. Okay, this is the body of the penis. These are called as crus. They are also called as the root or the crus. So on the crus of the penis, there will be a muscle covering that crus, that is called as the ischio-cavernous, covering the crus of penis on each side. So they are in pairs, as I said. Okay, so the first one is the ischio-cavernous. Okay, so this is in case of the male, but in case of the female, you can see here it is the ischio-cavernous muscle is there, but it is covering not the crus of penis, it is the crus of the clitoris. This is the crus of the clitoris on either side, root of the external genitalia. In case of female, this is the male and this is the female. So this is the crus of the clitoris. So it will be, this is the crus, and this is covered by the same muscle called as the ischio-cavernous. Okay, so the ischio-cavernous in case of male and female, as well as the bulbospongiosus. Okay, so here also you can see this is different via the side. So here is the crus. This is the whole thing is the superficial perineal pouch. So here on either side we have the crus of penis, and in case of female it will be crus of the clitoris, and it is covered by ischio-cavernous. In the center we have the bulb of the penis. Okay, so here is the bulb of penis, and it is covered by a muscle called as the bulbospongiosus. It is covered by a muscle called as the bulbospongiosus, covering the bulb of penis in case of male, and in case of the female it will be called as the bulbospongiosus. Same thing, but it will be covering just the external part. Okay, the part of the vagina on either side. Okay, so this is called as the bulbospongiosus. If you see here, this is the bulb of the penis in case of male, and this is the bulbospongiosus, the muscle. Okay, then the third muscle is called as the transversus perineal superficialis. The third muscle is the transversus. This is the transversus perineal. Okay, superficial. There is superficial as well as deep. So the superficial will be here. Okay, superficial transversus perineal. Okay. At the center, this is called as the perineal body. This is a very important structure, especially in case of female. Okay, so this structure should be intact. If not, there will be prolapse. Okay, so just in front of the this perineal body will be the vagina, and here is the urethral orifice. This is the vaginal orifice. If you can see here, so this is the vaginal orifice, and this is the urethral orifice. And in case of male, this is the roots of the penis, and here will be the body, and this is the glands of the penis. Okay, so this is about the three muscles. The three muscles are the ischio-cavernous, bulbospongiosus, as well as the transversus perineal muscle. Okay, so here you can see here, this is the ischio-cavernous, this is the bulbospongiosus, and transversus perineal will be there. It is not shown in this section. Okay, then there are three vessels. Two posterior scrotal vessels. If you see here, these are the two posterior costal vessels, as well as, that is the artery and the vein, as well as the nerve. Okay, two posterior costal scrotal or labial. In case of female it will be labial, or in case of male it will be scrotal. Okay, nerves as well as vessels on either side. If you can see here, there is artery, vein, as well as the nerve. Artery, vein, and nerve. Okay, as well as the transverse perineal vessel, as well as the posterior femoral cutaneous nerve, that will be also there in this space. This is the superficial perineal pouch, bounded superficially by the Coleys Fascia, and deeply we have the perineal membrane, and there are three muscles we have seen, and three vessels. Okay, as well as three nerves. Okay, all these will be present within this superficial perineal pouch. Along with that, the bulb of penis. Okay, scrotal vessels you can also see in this picture. Okay, the posterior, this is the perineal membrane shown in case of male, and this is the urethral opening, and here you can see posterior scrotal nerves and vessels. Okay, so this is the anterior triangle, that is the urogenital triangle, and this is the posterior triangle called as the anal triangle. Okay, we are talking about this region now, right now, and this is in case of the female. Okay, so we saw this was in case of male, and the same section in case of female. This is the crus of the clitoris. In case of male it was crus of penis, and the ischio-cavernous muscle was there. The same ischio-cavernous here, covering the crus clitoris. And then we have the bulbospongiosus. Here is the bulb of the vestibule, covered by bulbospongiosus. If you can see here, this is the bulb of vestibule covering bulb of penis in case of male, and here you saw it was the bulb of the penis. In case of the female it will be the bulb of the vestibule covered by the bulbospongiosus. The muscle is the same. Okay. Then we had the transverse perineum, same thing in case of both male and female. Then the 3 vessels and 3 nerves. Along with that, the fourth content will be the bulb of penis traversed by the spongy urethra in case of male. If you see here, this is the content. It's a bulb itself is the content. Okay, bulb of penis in case of male traversed by the spongy as well as the membranous urethra here. Okay. In case of the female, we have the vagina as well as the urethra in case of the female. Okay, so the vagina as well as the urethral opening you saw already will be also there in case of the female. Then along with that, the crus of the penis itself in case of the male, this is the crus of penis deep to the ischio-cavernous. In case of female, it will be the crus of the clitoris. Okay, so same thing has been shown here. This is the crus of the clitoris and this is the crus of the penis, and they are covered by the ischio-cavernous cavernosus in both in case of the male as well as the female. Okay, so all these are the contents of the superficial perineal pouch. The 3 muscles, 3 vessels, 3 nerves, bulb of the penis as well as the clitoris, the urethra as well as the vagina in case of female, the crus of the penis or the clitoris. All these are the contents of the superficial perineal pouch. Okay. Now going to the perineal membrane, a very important membrane which will be separating both the pouches. Okay, this is the perineal membrane. Superficial to that will be the superficial perineal pouch. Okay, and deep to that will be the deep perineal pouch. This is the deep perineal pouch here. Okay. So what is this perineal membrane? Okay, it is also called as the inferior fascia of the urogenital diaphragm, because there is something called as the superior fascia. We'll see that. Okay, superior fascia. If you see this picture, so this is called as the perineal membrane, or it is also called as the deep fascia of the or the inferior fascia of the urogenital diaphragm, and this will be called as the superior fascia of the urogenital diaphragm. Okay, so this whole thing is the urogenital diaphragm. Superior, we have the superior fascia of the urogenital diaphragm, and this is the inferior fascia of the urogenital diaphragm, also called as the perineal membrane. So perineal membrane, the other name is inferior fascia of the urogenital diaphragm. It's a strong sheet of fascia which extends across the pubic arch. Okay, if you see here, this is how it looks like. Okay, so this is the whole thing is the anterior triangle, which is also called as the urogenital triangle. Okay, so this perineal membrane covers the whole of the urogenital triangle across the region, and it is a strong sheet of fascia which extend across the pubic arch. So this is the pubic arch. Okay, this whole thing, this is called as the pubic arch. So it covers the whole across the pubic arch from one side to the other side, and intervenes between superficial and deep perineal pouch. As I said, so what is superficial to this perineal membrane will be the superficial perineal pouch. What is deep to that will be the deep perineal pouch. Okay, so this perineal membrane is a very important landmark which separates the superficial and deep perineal pouch. Okay. What are the structures which are piercing this perineal membrane? If you can see here, so this is the urethral opening as well as in case of female. So here you can see here this is the bladder, and this is the urethra which is piercing the perineal membrane. And here in case of the female, you have the uterus, and this is the vagina which is also opening. So there is vaginal opening as well as the urethral opening in case of female. Okay. So what are the structures? One is the structure, what are piercing? One is the urethra. Okay, this is the urethra here. Then the bulbo-urethral glands and artery of bulb of penis in case of the male. Okay, so the duct of the bulbo-urethral glands beside the urethra, as well as the artery of the bulb of penis in case of the male. Okay. And in case of female, there will be an additional opening, larger opening, that will be called as the vaginal opening. Okay, vagina in case of the female. Then we have 2 posterior scrotal vessels as well as nerve. We saw, okay, the posterior scrotal nerves and vessels. Okay, the artery vein as well as the nerves will be there. Then we have the deep artery of the penis in case of male, and in case of female it will be deep artery of the clitoris. This is the deep artery of the clitoris. Then in case of the male, the dorsal artery of the penis, and in case of female, dorsal artery of the clitoris. Okay, this is the dorsal artery, this is the deep artery. Then we have the artery of the bulb, duct of bulbourethral gland, then the posterior scrotal arteries and vessels. Okay, so this is in case of the male. Okay, this is the perineal membrane, this is how it looks like, and these are the crus, and this is the bulb of the penis, and this is the whole thing is called as the root, and this whole triangle is called as the urogenital triangle, and this is the body of the penis, and here is the urethral opening. Okay, in case of the female, this is the same perineal membrane, but in case of male it will be just one opening here deep to this, but in case of female there will be two openings. One is the urethral orifice, then the vaginal orifice. Okay, and beside that we have the crus of the clitoris. Okay, and this whole thing is called as the urogenital triangle. In case of this is the difference between the male and the female to appreciate. Okay, then as we said, deep to the perineal membrane, this deep to the perineal membrane we have a smaller pouch. This is called as the deep perineal space or pouch. Okay, what are the boundaries? Superficially we have the perineal membrane, as we know. Superficially we have the perineal membrane, and deep we have the superficial fascia of the urogenital diaphragm. Here you can see here this is the superficial perineal pouch, superficial to the perineal membrane. Deep to that, this space is called as the deep perineal pouch. Okay, so what are the boundaries? Superficially we have the perineal membrane, also called as the inferior fascia of the urogenital diaphragm. Then the deep we have the superior fascia of the urogenital diaphragm. Superior fascia of the urogenital diaphragm, inferior fascia of the urogenital diaphragm, also called as the perineal membrane. Okay, on each side we have the ischiopubic rami. On each side we have the ischiopubic rami on either side. Then we have posteriorly, it is closed by the union of the perineal membrane with the superior fascia of the urogenital diaphragm. The superior fascia and the inferior fascia of the urogenital diaphragm both join. Okay, so it is closed behind as well as even anterior. It is closed also in the front by the joining of the superior fascia of the urogenital diaphragm with the inferior fascia, which is also called as the perineal membrane. So the perineal membrane joining with the superior fascia of urogenital diaphragm, both in the front as well as in the back. So it is totally a closed membrane or closed space. Okay, deep perineal space is a closed space, but the superficial, as we saw, posteriorly it is closed but anteriorly it is open. Okay, clinically this is important. Okay, coming to the contents of the deep perineal space or the pouch. There are two important muscles here. Okay, in this space, one is called as the sphincter urethrae. Sphincter urethrae, as you can see here, sphincter urethrae. Then there is also called as the transverse perineum profundus. We will see that muscle, okay, in a short while. Okay, so there are two muscles, sphincter urethrae as well as the transverse perineum profundus. Then there are vessels. Okay, the internal pudendal artery, if you can see here, the internal pudendal artery which terminates into deep and dorsal artery of penis. In case of females it will be clitoris, and the artery of bulb of penis or vestibule. Okay, so that will be the internal pudendal artery which will be there here. Okay, then we have a nerve there that is called as the dorsal nerve of penis, or in case of female it will be called as the dorsal nerve of the clitoris on either side. If you can see here, there is the interpudendal artery and there is the dorsal nerve of the penis or the clitoris in case of female. Okay, then there is also the membranous urethra. Membranous urethra, you saw there is opening. In case of male it will be just one opening, in case of female it will be two. Okay, so in case of female there will be an additional opening called as the vaginal opening, that is for the vagina in case of the female. Okay, along with that there are some few glands there. Those are called as the bulbourethral glands and ducts in case of the males. Okay, if you saw this here, you can see here, you can appreciate these are the bulbourethral glands in case of the male. This is the section taken in case of male. Okay, so here you can see along with the membranous urethra, you can also see the bulbourethral glands in case of the male. Okay. Okay, so bulbourethral gland as well as ducts in case of the male. Okay, so these are the contents in case of the deep perineal pouch. Two muscles, then there is an artery as well as a nerve, the internopudendal artery as well as the dorsal nerve of the penis or clitoris. Then we have the dorsal nerve of the penis or clitoris. Then the artery of the bulb of the penis is also there. There are two arteries, internopudendal artery as well as the artery of bulb. Then there is the dorsal nerve. Okay, then we have the membranous urethra in both male and female, and vagina and additional opening in case of female. Then in case of male there is bulbourethral glands and ducts. Okay, so these are the contents of the deep perineal pouch. Okay, now coming to the urogenital diaphragm. There is an important diaphragm here which is called as the urogenital diaphragm. What is this urogenital diaphragm? It is nothing but the musculofacial partition across the pubic arch and separates the pelvic cavity from the anterior part of the pelvic outlet. So what is this? So these are nothing but the same two muscles which we are discussing, sphincter urethrae as well as the transverse perineum profundus, which are the contents of the deep perineal pouch. So this is the perineal membrane, this is the deep perineal pouch, and there is a sphincter around the urethral opening. So this is called as the external urethral sphincter, or it is also called as the sphincter urethrae. Then we have the deep transverse perineum muscle, which is also called as the transverse perineum profundus. Okay, which were the muscles of the one of the content, two muscles, sphincter urethra as well as the transverse perineum profundus. These are the two important muscles of the deep perineal pouch, and these together they will form a diaphragm that is called as the urogenital diaphragm. It is a musculofacial partition across the pubic arch. You saw the pubic arch and separate the pelvic cavity from the anterior part of the pelvic outlet. Okay, so this is formed by the two muscles. One is called as sphincter urethrae and the second one is called as the transverse perineum profundus. The nerve supply of these muscles is by the muscular branches of the perineal nerve. Muscular branches of the perineal nerve, which will be supplying both these muscles. Okay. So what are the structures which are piercing this urogenital diaphragm? Okay. One is the urethra itself. Then the vagina in case of the female. There is an additional opening here in case of female. This is called as the vaginal opening. In the front we have the urethral opening. Okay, what are the actions of these muscles or the urogenital diaphragm together? One is it support the prostate and the bladder in case of the male, and in case of the female it will be the vagina, uterus. Okay, so in case of the female, so it supports, if you see here, this is the perineum membrane, this is the deep perineal pouch within which will be the urogenital diaphragm, and above that will be the prostate. This is the prostate here, and this is the urinary bladder in case of the male. In case of the female, it will be the urinary bladder there along with the uterus as well as the vagina itself. The second important function of this is around this vagina, around the urethra as well as around the vagina, the muscle is spreading out and it is covering the whole of the vaginal opening. So whenever this muscle contracts or the urogenital diaphragm contract, it constricts the vagina in case of the female. It helps in the constriction of the vagina in case of the female. It also fixes the perineal body. Perineal body is a very important body. As I said, it is behind here between the urethra and the anal opening at the center. Behind the vaginal opening and the anal opening, there is a very important body where all the muscles come and join together. Okay, that point is called as perineal body. Okay, and if it is torn or it becomes lax, as in case of the vaginal delivery or some tear in the perineum, which leads to the tear of the perineal body itself, then there might be a condition called as prolapse. We will discuss that later. Okay, so this perineal body is a very important structure here, which is present between the vagina and the anal opening. Okay, at the junction of the anal triangle and the urogenital triangle. Okay, so this fixes the urogenital diaphragm also helps in the fixing of the perineal body. One is it supports the prostate and the urinary bladder in case of male, and in case of female it will support the bladder as well as the vagina as well as the uterus itself. Then it also helps in the constriction of the vagina and the third is it fixes the perineal body, and it also acts as a sphincter around the urethra. Urethra, we already saw that it is called as the external urethral sphincter or sphincter urethrae. Okay, what's the function of this around the urethra? The sphincter urethrae exerts voluntary control of the maturation and expels the last drops of urine. So the last drops of urine can be pushed out by the constriction of the external urethral orifice. So both the orifice, this urethra as well as urethral orifice and the vaginal orifice are covered by this muscle or the two muscles of the urogenital diaphragm. Together they are called as the urogenital diaphragm. Okay. Now the muscles of the urogenital region together. We'll study now all the muscles which are there in the urogenital region, which we studied already. Okay. So they are present in two layers, the superficial and deep. As we saw, the superficial layer will have the ischio-cavernous as well as the bulbospongiosus as well as the superficial transverse perineum. We saw that the bulbospongiosus, then we have the ischio-cavernous. Here is the ischio-cavernous, and this is the bulbospongiosus. This is in case of female and this is in case of male. Then we saw the transverse perineum, superficial transverse perineum muscle. Okay, these were the three superficial muscles which were present in the superficial perineal pouch. In the deep perineal pouch, there are deep layers of the muscles. Which are those? One is the sphincter urethrae, we already saw, as well as the deep transverse perineum. Okay, which are the two muscles of the urogenital diaphragm or the deep perineal space. Okay, so these are all the muscles of the urogenital region. So here again you can see the difference between the superficial perineal pouch and deep perineal pouch in case of the male and the female. Okay, so here is the superficial perineal pouch and here is the deep perineal pouch. Okay. Coming to the last part, that is the applied aspects, clinical aspects of this. One is the extravasation of the urine. As we said, the superficial perineal pouch is open. Okay, so if there is any rupture of the urethra in case of the superficial perineal pouch, if you can see here is the perineal membrane, and superficial to it, that is below it, is the membranous urethra, and if there is a rupture of this urethra, then you can see here there is collection of the urine into the scrotum, around the penis, as well as into the anti-abdominal wall also. Okay, because it is passing through this superficial fascia. Okay. Okay, so this is the extravasation of the urine in case of the rupture of the urethra in case of the superficial perineal pouch. But if it is below and if it is above, then there is extravasation of the urine in the upper part. Okay, so here this is the difference between the extravasation below, if there is rupture below, and if it is above. Okay. So there is urine extravasation in the retropubic space and around the bladder and the prostate. Okay, so if it is higher up, okay, above the perineal membrane, so it is around the prostate and the bladder. Okay, so this is how you can differentiate between the extravasation if there is a rupture of the urethra below or above the perineal membrane. The second is the perineal body tear during delivery leads to prolapse of the uterus. As I said, the perineal body, which is an important muscular structure between the urogenital diaphragm and the anal triangle, that is between the anal opening as well as the vaginal opening, there is an important body, muscular body, where all the muscles come and join together. Okay, and if there is a tear in this perineal body during delivery or in case of any mismanagement during the forceps delivery of the newborn, at that time if there is perineal tear in the perineal body, then it leads to prolapse of the uterus. Then the third is the diseases of the pelvic organ lead to referred pain in the perineum, because the pelvic organs will be referring their pain into the perineum, because the nerve supply is similar to these pelvic organs and the perineum itself. Okay, so the pain will be referred into the perineum instead of when the pain is developed in the pelvic organs, it is referred to the perineum. Okay, so this is all about the superficial and the perineal purchase, and together the whole of the urogenital triangle or the urogenital region. If you have any questions, you can pose to me, and inshallah I will try to answer. Thank you very much. These are my references. Okay, thank you very much. Hi friends, if you like my video and if you want to see similar kind of videos in the future, subscribe to my channel as well as like the video. Press the bell icon so that you can get regular updates and you will be the first to get the updates. Then you can also comment as well as share this video with all your friends so that all can benefit from this. Thank you very much.